Well, hello, everyone. Thank you so much for joining us to hear about the undergraduate health psychology program here at Bastyr. I am going to be recording the session. I know some people are very busy with school commitments or commuting home or working at their jobs, taking care of their families and pets at this hour. So if you're not able to join us, I think you'll be able to get a copy of our webinar. So you can take a look at that at a time that works for you. So I'm going to go through the slides, and then if anybody has questions, you can put them in the chat, or I will certainly leave time to address questions at the end. So first off, you probably want to know who I am, talking away here. So I'm Naomi Lester. Welcome. I've been at Bastyr for quite a while. I'm a research health psychologist, so I'm in the branch of psychology that doesn't have clinical training. Health psychologists don't care for clients necessarily when we have a research background. We more focus on the basic research that helps clinicians, and of course, we love teaching. So previously, I had positions at Duke University Medical Center, where I was studying how people cope with chronic pain, and then working as a professor in the University of Florida system, and also at University of Washington. And then I was very fortunate to be able to come over here to Bastyr to help start up our undergraduate health psychology program. And I've liked it so much, I've just never left. It's our fabulous students and our wonderful community and our mission that really keep me here. My current roles are I get to work with students, which is fabulous. Also leading students in the opportunity they have for research, doing a research project in the program. And I do some behind the scenes work, things like making sure everything's spick and span for accreditation and updating the curriculum based on trends of interesting things going on in the field. And then as a research health psychologist, my bias is that I really feel it's important to view people as a whole, to look at people's health and well-being from their biology, their psychology, social aspects, and the spiritual aspects of their health. And I'll talk a little bit about that as we go along. So our approach here in the program is really looking at the biopsychosocial spiritual understanding of health and well-being. We cover core areas of psychology, and our curriculum is tied to the national standards for undergraduate education in the field. Those competency areas are all built into our curriculum. But then we also cover some really interesting emerging areas, things like spirituality and health. How do aspects of people's spirituality impact their well-being? And things like eco-psychology. We know that people's interaction with the wonderful natural world impacts their health and well-being and impacts their behavior in terms of ecological-based behaviors. We think it's very important to help students develop core skills, things like critical thinking, information literacy, particularly in the area of health information, so that people are much better equipped to understand this huge world of complicated information that's available. Working on communication skills, both verbal communication and writing, and then the ability to work with many, many others from lots of different backgrounds. It's absolutely a vital skill in our world today. There are lots of options in the curriculum for integration with other fields. Things like, of course, we have our 2 tracks, and I'll talk about those. So there are opportunities for pre-medical studies. And then lots of opportunities for electives in fields like nutrition and herbal sciences, activity electives in different exercise areas, and lots of interesting opportunities that you might not be able to find at other institutions. And then I think also one real plus of Bastyr is a really vibrant community, that people are not just here by chance, but work really hard to get to Bastyr. And I think sometimes in class they learn more from their peers than they do necessarily from their professors, because people are very curious. They're interested in what they're learning. They want to extend things. They want to look at things from many, many different standpoints. And then as a private institution with really dedicated people, our approach, focuses on having faculty who really care about your learning. We're really, committed deeply to help you develop, to figure out how to assist you in learning, to figure out what you need, and help you find your way along your path. So you may still be wondering, well, what is health psychology and why would we want to study health psychology? So health psychology is really focused on looking at how is it the things we think, the things we do, the things we believe interact with our biology and the physical environments and the social environments we live in. How do those things really impact our health and our risks for different kinds of health difficulties? And on the flip side, how can that understanding help us figure out how to promote people's health and well-being and improve their well-being? And as I'm sure you know, many of the leading causes of illness and death in America today are really strongly tied to those interactions between the things we feel, the things we do, our spiritual sense, our environments, what we eat, how we move, how we interact with people. So the program really helps us understand those kinds of interactions. And, as part of that, it's very important to look at what are good prevention efforts? How do we look at the whole person in terms of treatment? It's a really broad perspective on health that I think is very, very important to the kinds of challenges people have today. So a few things about program basics. The health psychology program is a bachelor's completion program. So people come in with the first 2 years of their undergraduate experience, which is about 90 credits. And then at Bastyr, folks finish up what would be the junior and senior undergraduate year in 2 years with those second 90 credits. We do have 2 tracks. We have our integrated wellness track, and we also have our pre-medical track. And the curricula for both of those tracks is on our Bastyr website. And I'm happy to show you the link for where to find that as soon as we finish up the slides here. There's lots of detail about what's included as the courses for both tracks. Both tracks include coverage of the core psychology areas, and then our cutting edge and emerging areas are also part of that. Integrated wellness has lots of room for electives. There are more credits available for electives in integrated wellness. There are fewer elective credits in the pre-medical track. And as you'd anticipate, that's because folks are quite busy taking our chemistry series with organic chemistry and biochemistry, and also anatomy and physiology, which are all needed for a number of graduate medical programs. So you may be wondering, what do the graduates do? Which is a very good question if you're thinking that. There's some variability based on the track. that people engage in. So for the pre-med track, a lot of our folks go on to master's programs in nutrition and acupuncture. Also physical therapy, both at the master's level and the doctorate level, nursing, and then naturopathic medicine, as well as more allopathic and osteopathic medical programs. Some chiropractic, but more osteopathic historically in the program. We currently have grads who are in the naturopathic medicine program, both in Kenmore and in San Diego. So folks from the undergrad psych program have gone to both, and folks who've gone to more traditional allopathic medical programs as well. And then folks in integrated wellness, a fair number of folks go on to master's programs in mental health counseling, including lots of people who stay for the Bastyr Masters of Arts in Counseling Psychology. I think it was 4 of the graduates from last spring are now in our master's program. We also have folks going to school counseling, lots of different programs, and doctoral level in clinical psychology and counseling psychology. Public health, definitely. And we've had lots of our program grads stay for our Bastyr Masters in Public Health program. And also social work, both more traditional social work and clinical social work programs. And then for folks who do direct entry work after their bachelor's degree, and a lot of our folks work for a few years and then decide they want to go to grad school. But lots of folks really need to work for a few years to earn up a big bunch of money and then launch into their next academic adventure. We've had folks who've done lots with different areas in education, including quite a few folks who've done jobs in sort of environmental or outdoor education with both children and adults. Work in social services, a very wide variety of social service work. Work in social and health advocacy in hospitals, sometimes within the legal system, within social service systems. And then some folks who've gone into more the natural products or health and wellness industry. And interestingly, talking with some of them, they have found that that seems to be a place where they feel they can help promote wellness in a natural way that isn't a clinical specialty. They develop things that help people feel better, and that they feel very good about that work. So our grads are doing, all kinds of really nice things. So I have a few kind of profiles of some of our graduates that I thought I'd share with you. I know students are always very interested in hearing what graduates are up to. So the first profile is for Bella Jelly Gomez, who did our integrated wellness track, and then was trying to decide, does she want to go the route to study naturopathic medicine or to study in the master's in counseling psychology program? And she went back and forth and decided to do a post-baccalaureate basic sciences program and then enter the naturopathic medicine program in San Diego. And she's in her 3rd year of that program. Second is Jill. Jill did integrated wellness, and Jill went on to study master's in counseling with a specialty in drama therapy as part of expressive arts therapy. Jill's out working now as a counselor and doing lots with drama therapy and more broadly with different kinds of expressive arts therapies. and she's found that her training was a really good preparation for doing that work. Celeste was part of our pre-med track, and she was working as a certified behavior technician for children with autism and other related disorders, while also being in a master's program at University of Washington in special education, focused on intervention and treatment for children and their families who are struggling with autism and related kinds of challenges. Then there's Anne, who completed the undergrad program and also our Bastyr Masters in Public Health. And Anne's out working now with several elder care centers, helping to design wellness programs, very holistic wellness programs for the elders. And I find it interesting that when she joined the undergrad program, she wanted to focus on adolescents. And then when she finished her public health program, she decided she very much wanted to work with elders. And she said, it was really great to learn about lots of different people. And I think I found my niche. So that's about Anne. And then the last profile is Jeff Holgren, who did our undergraduate bachelor's program. Jeff came to us as a military veteran and completed our program and then went on to a PhD program in clinical psychology and is currently serving as a trauma specialist as part of a group who goes into very challenging areas to help train local individuals to provide trauma interventions. Jeff's made a number of trips to Ukraine, and Jeff is currently working in Israel during the difficulties that are going on there at the moment. And our Bastyr website provides some overview of a number of other of our graduates if you want to learn more about what folks are doing. The Bastyr website also has information about many of the wonderful faculty members who teach in the program. There's some sort of special features about folks like Dr. Ung, who's a clinical child psychologist and works with families. Dr. G. Coyne, who's a clinical neuropsychologist and also has a specialty in sports and exercise psychology. Dr. Ho, who's a clinical psychologist, and Dr. Ho's specialty is in multicultural counseling. And also Dr. Gabriel, who leads our 4-course sequence in spirituality and health, who's got a specialty looking at the role of mythology as well as world religion and well-being. So there's lots of interesting folks who teach our classes and work as part of our team. I also included this information about typical paths that folks take with our program. There are, of course, many, many different things you can do. I'll put a link to a nice careers guide from American Psychological Association into the chat when we come back together as a full group. But it's just another summary of some of the wonderful things our folks are doing. I mentioned a few times the opportunity for doing a research project with a faculty member as part of our undergraduate program. The Bastyr website has a much longer list of many of the projects, but I wanted to highlight just a few and tell you what those folks are doing now. There's this one, the role of patient spiritual experiences in naturopathic practice. This was conducted by a student while he was here, and then he went on to get his PhD in counseling psychology and has worked with homeless youth. And then currently he's working with the Veterans Hospital in San Diego. The Tai Chi and Qigong in treatment for panic disorder. The individual who did that project also finished a PhD and is now the clinical director for a pain care center in Montana. The community gardening and biopsychosocial well-being. Two students worked in a team on that project last spring. One of those students is now in a dual master's program in social work and health advocacy work focusing on trans youth at Columbia. And he said, oh, I really like my program, but I miss all my classmates who are still in Seattle. That's what he said last time I talked to him. And the research partner there is taking a year off before she goes on, wanting to study nutrition with a focus on community nutrition and community gardening. So these folks go on to do all kinds of interesting and important jobs. So you may be wondering what really makes Bastier's health psychology program unique? And like, what's different than just going to another university? And there were a few things I wanted to highlight. I've already kind of covered some of these, but you tend to be in classes that have a pretty low faculty-student ratio. It's the kind of program where you're really not a number to us. We know when you're in class, we know when you're engaged, we can tell from your face when you're looking confused. We really want to help everybody learn. And like I said earlier as well, you'll meet some really engaging classmates, people who come from very interesting backgrounds, people who've come from, many different states, different jobs that they've engaged in. And it adds this wonderful richness to discussions in class, to projects, to different perspectives. And then I've talked some about the research project. That's an opportunity that's becoming increasingly rare in undergraduate education. And we think it's really important to provide that opportunity. It's an option. So we build that in as an option. I've talked a little bit about the spirituality and health sequence on Dr. Gabriel. And then the whole person focus on health and wellness and some of those very unique electives. I had classes on the students yesterday, and we were looking at the list of winter electives, and there were things like Tai Chi, beginning level Tai Chi, and winter wildcrafting, and herbal medicine making for all, and a field elective that had to do with gathering seaweeds and sea vegetables and their nutrition and their medicinal values, and all sorts of interesting experiences that people can have. So just to kind of wrap up, what we're all about, we think that biopsychosocial spiritual understanding is very important. We want to understand how that shapes people's health, and then how we can use that understanding to help folks improve their health and their well-being. And then combining that with the importance of developing these really basic, absolutely vital skills: critical thinking, understanding biases in thinking, how to communicate, how to work with other people. We think, no matter what you do, those are very, very important. So This is a picture of some of our current students. And you may be wondering, like how many people on which track. Currently, it's about half and half. About half the students are doing integrated wellness and half are doing pre-med track. That varies year to year, but currently it's about half and half. And this is a picture from our new student orientation this past fall. And I showed this to folks in class yesterday, and they're like, yes, yes, invite everybody to come and visit the program. We'd love to meet people. We're not always all students who identify as female. We certainly have folks who identify as male and as male or female and them. It just happens to be a picture of many of our students who predominantly identify as female in this picture. But they all invited you to come and meet them and participate. So hopefully you're very excited and have thought of lots of good questions. So what should you do next? I think you should probably contact one of our admissions folks. We've got lots of different folks in admissions who would be happy to help you. I happen to list Tristan's name here. We also have Jill, who's very engaged with your program and would be happy to answer your questions. But you know, everybody at Bastyr would be happy to direct you to help find the information that you need. So let me stop screen share here, and I will show you a few other resources. Let's see. I will put the name of that APA guide here into the chat for you. So you have that available. And then also, let me just show you what that landing page for the program would look like when you go to the Bastyr website. So when you go to the main Bastyr website, you'll see lots of options. This happens to be the page for the integrated wellness track. There's also one for the pre-med track, of course. And just look under bachelor's degrees or look under the field of psychology, and it'll lead you to very informative pages where you can find out more about the program, some of the program basics, information about cost, some other information about past students, grads, and then, oh, campus is gorgeous. So yeah, another big plus. Oh gosh, there's me. These different faculty are previewed here. And then down here, you'll find a link to lots of information about which classes. There's prereqs information, and then what kinds of classes you would have each quarter. And it's different depending on your track. For the pre-med track folks, most of the basic science courses would occur in your junior year. The chemistry series courses and the anatomy and physiology courses with their labs. So I will stop sharing that. And of course, the Bastyr website's full of all sorts of other interesting information and interviews with folks, and you know, clips to fun recipes for every season of the year, and health tips, and links to our wonderful library, and other things that you might be curious about. So let me stop recording here, and then I am happy to hear from folks about the questions they have.